Did a blood test today prompt you to forego your morning coffee? Or perhaps you completely avoided the C, believing you were acting appropriately. As a brain doctor, allow me to share a startling revelation with you. Particularly around the age of 60, one or two little errors prior to a blood test might subtly increase blood pressure, thicken blood, and in the worst situations, cause a stroke. Yes, I am aware of it. Blood tests are meant to be secure. Normal, nothing special, isn't it? Here's the reality, though. Most medical professionals don't speak aloud. For elderly people, particularly those with fragile blood vessels and a slightly less responsive neurological system, not only is it uncomfortable to get it incorrectly before a blood draw, it might be harmful. And what's even more concerning, the majority of adults over 60 unwittingly commit at least 3 of the 10 serious errors I'm going to list. Not once, but each and every time they get a blood test. You should therefore view this entire video, because what you do before the nurse even enters the room poses more of a risk than the needle itself. If you stay with me, I'll teach you how to safeguard your heart, intellect, and possibly your life. Beginning with your upcoming blood test, please share your experiences in the comments if you have ever felt lightheaded, exhausted, or a touch strange after having your blood drawn. If, don't hit 0. Additionally, for more life-saving advice, remember to sign up for Health 365. Let's now discuss the potential effects on your brain of not drinking a simple glass of water. Let's begin with the one error that may seem harmless at first, but it can subtly cause problems. Avoiding water consumption prior to your blood test. As you can see, a lot of individuals believe that fasting entails not eating or drinking anything. As a result, they forego both breakfast and water. That is a serious issue, particularly for those over 60. Your blood thickens when you're even a little dehydrated. It moves more slowly and requires more effort from your heart to pump. Just that can cause an increase in your blood pressure just before the test. What's even riskier, though? It is more difficult for thicker blood to get to your brain. People begin experiencing lightheadedness, vertigo, or worse, a mini-stroke known as a transient ischemic attack TIA. It may occur suddenly, particularly if your vessels are already susceptible from aging. Seniors who fasted without drinking enough water had almost twice the chance of experiencing abnormal blood pressure changes during routine morning tests, according to a 2022 study published in the Journal of Vascular Health. Additionally, some people experience fainting episodes following blood draws. Frequently, it's the dehydration needle. Here's a quick habit to help you stay safe. Drink an 8-ounce glass of water 1 to 2 hours prior to your blood test. Just enough to support healthy blood flow, safeguard your brain, and maintain the accuracy of your numbers. Neither too much nor too little. Speaking of what you put into your body before an exam, let's discuss a salty food you may have consumed the night before without realizing the danger. Let's now discuss your dinner from the previous evening, especially the amount of salt on your dish. It might have been a fast snack of instant noodles or a warm bowl of canned soup. You believed it to be a single meal. The exam is scheduled for tomorrow morning. Not a huge deal. Here's what actually occurs, though. Meals high in salt, particularly in the late evening, might raise blood pressure as you sleep. Also, that salty dinner has a double-edged effect because blood pressure naturally increases in the early morning. Right before you go for the clinic, it causes your blood pressure to skyrocket. Now consider this. Your arteries have changed over time. They get stiffer as we get older. They no longer grow and shrink like they did in our 30s. Therefore, there's nowhere for the pressure to go as it spikes. Your brain is directly strained by that, particularly the little blood arteries located deep within. According to a study published in the American Journal of Hypertension, eating salty meals late at night raises the risk of strokes in the morning by over 35% in older persons. And that's before your skin is ever touched by the needle. Additionally, salt draws even more water out of your cells if you're dehydrated from fasting, thickening your blood and upsetting your electrolyte balance. What can you do then? Use less salt the night before your test. Steer clear of processed or packaged foods, salty chips, soy sauce dips, and deli meats. Eat only home-cooked food that has been lightly seasoned. Both your heart and brain will appreciate it. As we discuss test preparation, there is another error that can be equally dangerous, particularly if you are taking heart-related drugs. Next, let's examine that. Suppose you're wondering if you should take your morning medications because you have a blood test coming up. Thus, you neglect to take your blood pressure medication or the small blood thinner. Just stop there. Never presume that stopping your medicine before a test is acceptable unless your doctor has specifically instructed you to do so. This is especially true for blood pressure or cardiac medication. A rebound impact may result from skipping merely one dosage. Unpredictably, your blood pressure may rise, or your blood may suddenly become more susceptible to coagulation. And that's a big deal for senior citizens. For instance, the Cleveland Clinic conducted a research titled 20 Times Under 21. They discovered that people over 60 who stopped taking their antihypertensive drugs without consulting a doctor were 42% more likely to experience unusual rises in their systolic blood pressure during standard checkups. Additionally, in several instances, it prompted emergency care within a few hours. This also applies to blood thinners. Ignoring them may raise your risk of stroke due to unexpected clot formation, particularly if you're stressed, dehydrated, or hungry. I understand now. We occasionally worry that medications could affect the outcome of blood tests. Here's the reality, though. If a drug may have an impact on your lab results, your doctor will explain how to control it in advance. I suppose work is risky. Thus, see your doctor prior to your next test. Simply inquire, should I take my morning pills before the blood draw? This 5-minute talk has the potential to save your life. Let's move on to a topic that many people believe they are performing correctly, but it actually endangers your brain. Extending your fast beyond what is necessary. Many people believe that if 8 hours is sufficient, then 14 must be as well. They therefore forego breakfast, dinner, and lunch the day before, stop eating after lunch, and arrive at the lab exhausted. The issue: when you don't drink enough water and fast for more than 12 hours, you have too low blood sugar. And it goes beyond simply feeling hungry or weak. Your blood pressure, cognition, and equilibrium can all be impacted by low blood sugar. Before you even sit down for the test, it may cause you to pass out. This is particularly sensitive to older folks. In 2020, a Johns Hopkins study tracked people over 65 who had fasted for more than 13 hours prior to blood work. Before or immediately following their blood draw, almost 1 in 5 people had symptoms like lightheadedness, blurred vision, and occasionally a temporary loss of consciousness. Furthermore, none of these people had serious health issues. These were regular elderly people attempting to do things correctly. This is the wiser course of action. Unless your physician says otherwise, continue to observe a 10 to 12-hour fast. Eat a light dinner the night before if your test is at 8 a.m. or 8 p.m. That gives you ample time to get precise results without putting your health at risk. Additionally, remember to sip that glass of water. Next up, we'll discuss a morning routine that may seem innocuous, but it may be causing your heart to race before your blood test even starts. It has been a part of our routine for decades, particularly before going for a blood test or anything similar. It helps us focus, wakes us up, and, to be honest, it feels like a cup of hug. Here's the catch, though. Not only does caffeine stimulate your brain, but it also awakens your heart, sometimes pushing it too far. Coffee consumption immediately before a blood sample might raise blood pressure and heart rate, particularly in those over 60. That may result in erroneous test results or worse, strained blood vessels that are already susceptible as you age. According to a 2021 clinical evaluation in hypertension research, seniors who drank coffee within 2 hours of taking the test had an average systolic measurement that was 12 points higher. That's plenty to deceive your physician or conceal a real blood pressure issue. However, it's not only about figures. Just prior to having your blood drawn, that caffeine spike may cause you to feel jittery, lightheaded, or even nervous. Additionally, the coffee is more potent if you have also been fasting. It can cause a blood sugar fall or an accelerated heartbeat when taken empty. What about exercise now? The benefits of doing out in the morning before a blood test may surprise you. You're attempting to maintain your health, and perhaps you enjoy getting some exercise in the morning. That's fantastic. However, your morning exercise may be more detrimental than beneficial if you're going to a blood test. As you can see, exercise, particularly vigorous exercises like resistance bands, brisk walking, or even vigorous gardening might momentarily increase blood pressure and heart rate. That's typical. However, this little increase can lead to inaccurate test findings or even cause your heart to beat too quickly when you're over 60 and your cardiovascular system is already exerting a bit more effort to keep things in balance. An American Geriatric Society research from 2020 tracked elderly people who worked out 2 hours before to standard blood testing. The findings revealed notable variations in heart rate, stress hormone levels, and blood pressure readings, enough to skew the interpretation of important indicators. Even worse, a small percentage of test takers complained of chest pain and vertigo. Their body hadn't completely healed from the needle, not because of it. Exercise. In the event that your blood vessels are, when your body is already somewhat rigid and dehydrated from fasting, exercise might momentarily decrease blood flow to the brain. Lightheadedness or worse, a TIA, are likely outcomes of that. So what I want to do? Be gentle. Don't use the weights, the treadmill, or even the power walk. Stick to deep breathing or gentle stretching instead. Put off working out completely until after your blood draw. In relation to circulation, let's discuss something that most people overlook. What are you wearing? Apparel. Indeed, your attire has a greater impact on your blood test than you may realize. It's a typical practice. Putting on tight sleeves, tight compression equipment, or even an overly tight belt. Particularly for a doctor's appointment, we want to seem presentable. However, tight clothing might subtly affect your circulation, particularly around the arms or waist, and that could lead to serious issues for someone over 60. Your veins don't react well to even a small restriction in blood flow. It may make it more difficult for the nurse to locate a suitable vein, resulting in increased discomfort, longer needle times, and more pokes. However, even when the blood is extracted, the restricted circulation may cause numbness, sudden lightheadedness, or even fainting. According to a clinical nursing research study, older persons who wore tight waistbands or sleeves during lab visits were more likely to have delayed onset dizziness following the draw, particularly if they were also fasting or mildly dehydrated. Now this is your turn. Put on something relaxed and cozy. Select a shirt with easily rollable sleeves or one with short sleeves. Keep waistbands and belts loose. You'll feel better, heal more quickly, and have a lower risk of problems. Let's now examine something you might not even be aware of. However, it has a significant effect on your heart and brain. How effectively? The previous night, you slept. Go to sleep. Although it might seem easy, skipping even a few hours the night before your blood test can subtly raise your risk of stroke. Your body suffers the following morning when you don't get enough sleep, whether it's from stress, discomfort, or simply tossing and turning. Additionally, the impacts are more severe for older persons. In addition to leaving you exhausted, inadequate sleep interferes with the processes that regulate your heart and blood vessels. Research indicates that sleep deprivation triggers your sympathetic nervous system, which controls your body's fight-or-flight response to. Start early. This causes your heart rate to rise, your blood vessels to constrict, and your blood pressure to rise. According to a 2021 study published in the Journal of Sleep Research, persons over 60 who slept for fewer than 5 hours before to a medical test were far more likely to have vascular spasms, both during and after blood tests. Before you enter the clinic, your body is already under stress, even if you don't feel exhausted, and your chance of lightheadedness, an irregular heartbeat, or a transient ischemic attack increases significantly when you combine that with fasting, worry, or mild dehydration. What therefore ought one to do? Wind down early the night before your test. An hour before going to bed, turn off all screens. Hold on to the gloomy, quiet, and cold room. Try to get 7 or 8 hours of sleep. It is necessary for your heart, brain, and blood vessels. Additionally, Don't leave right away when the test is over, especially not while driving. Let's discuss the reason. You're prepared to go home after completing your blood test and pulling off your sleeves. However, if you haven't eaten yet and intend to drive, please wait a little. Although it might seem safe, driving immediately after a fasting blood draw is actually one of the riskiest things you can do, especially if you're older than 60. This is the reason. Your blood sugar is already low after 10 to 12 hours without eating. Add the blood stress. Your body is in a vulnerable state due to draw, potential dehydration, and possibly even a restless night. Now picture yourself driving a car. A fast decline in blood sugar might cause lightheadedness, impaired vision, slowed reflexes, or even fainting. That puts everyone on the road in danger, not just you. Within 30 minutes of leaving a clinic, older persons frequently experienced fainting episodes or confusion, the majority of which occurred while they were driving alone, according to a case study published in the American Journal of Emergency Medicine. Fasting and neglecting post-test recovery are common factors. What is the safer strategy, then? After your test, have a modest snack that contains protein and some healthy carbohydrates. Take a break for. If you feel even a little strange, spend 10 to 15 minutes at the clinic. Ask a friend or relative to drive you home if at all possible. Don't disregard it if you continue to feel ill hours after the test. Next, let's discuss it. You finished the test, eaten your snack, and returned home when all of a sudden you feel a little lightheaded, possibly a little queasy, or just strange. It's probably nothing. You think, I'll simply take it easy. Here's the problem, though. These minor symptoms can be your body's warning sign, particularly if they occur a few hours following a blood draw. Even slight dehydration or a sudden drop in blood sugar might trigger a series of nervous system reactions in persons over 60. And occasionally, that results in a mini-stroke, also known as a transient ischemic attack, or TIA. It is a brief interruption of blood flow to the brain that could only last a few minutes. Ignoring it, however, can be a grave error. Indeed, according to a 2022 study in the Stroke Journal, about 15% of senior citizens who reported, following fasting blood testing, symptoms of nausea or dizziness were eventually linked to mild brain ischemia, which are microscopic strokes that frequently go undetected. Pain is not usually associated with these symptoms. There's only a slight unsteadiness or pain, no slurred speech or sagging of the face. They are therefore simple to ignore and overlook. Here is the rule, then. Don't wait it out if you feel lightheaded, queasy, dizzy, or especially weak after a test. Tell someone, take a seat, and drink some water. Call your doctor if it doesn't go away right away, or if it becomes worse. Let's conclude by going over a few things to consider before you return. A blood test could appear to be a minor issue, but after the age of 60, even seemingly insignificant activities can have a greater impact on your heart, brain, and safety than you may think. The good news is that you are in charge. Just enough water should be consumed. Don't forget to take your medications. Get enough sleep. The night before, eat light. Above all, pay attention to your body. Although these aren't significant modifications, they offer significant protection. If you learned anything from this video, please share it in the comment section. Remember to sign up for Health 36 as well, as every little step you take will lead to better days in the future.